lot of people have heard of this by now. There's a lot of athletes that are using this, a lot of people using this for wound recovery, tissue repair. It's a very potent peptide that's made naturally in your body. Hello and welcome to the Weaponized Body podcast. I'm your host, Dr. Ryan Hewitt. And as always, every week we're bringing to you some hot topics on performance health recovery when it comes to your metabolic health, your movement health, and your mindset. So today, I'm going to introduce a topic that is currently controversial. It is also a topic that I'm really passionate about, and I think a tool for people, and it is a tool that's going to be used more and more as time goes on, and that's peptides. There's a lot of buzz around peptides. I think especially because most people have heard of these particular peptides for weight loss, the fat shot, as so to speak. So the semaglutides and the tirzepatides, or the commercial names of Ozempic, as well as things like Mounjaro, etc. And we're going to touch on these today. But there are also other types of peptides, not so much specifically for weight loss, but also for health optimization, for recovery, for performance. And these are some things that I've dabbled with personally over the last couple of years, done a lot of research, and now working with Weaponized Wellness, we're overseeing a lot of different patient case studies when it comes to some of these peptides that are FDA approved and that have medical oversight. So we'll talk a little bit about all these things. So what I'll do first is just introduce peptides in specific, what they are and why they become so popular. So peptides, really, they're just um, amino acid chains. So they're proteins. And the goal of a peptide is you want that peptide to mimic a process in the body that's already naturally occurring that's desirable. For example, a peptide that you want to assist your body's ability to release more growth hormone. As you probably have heard, growth hormone is important for muscle building, fat loss, for recovery, etc. So what peptides aim to do is they mimic the signaling molecule in the body to release growth hormone. So and that can be done for a few different processes in the body, but that's just one example of like a peptide mimicker that signals natural processes. Of course, there's other types of peptides that aim to do different things, like GLP-1s, the receptor agonists. In other words, they try to prevent certain things from happening, and they try to promote other things to happen. So it really depends of the goal of what you want the peptide to do in the body. And really, in a lot of cases, the peptides or the protein um, signalers, they look like the hormones in the body that are stimulating natural processes. The growth hormone, for example, is stimulated by the pituitary. So the goal of the peptide is to stimulate the pituitary in order to release more growth hormone, or other effects to stimulate other hormones like satiety hormones, like ghrelin, for example. There's hormones that will stimulate that because ghrelin is associated with also growth hormone release. Anyways, and there's also peptides that actually mimic the actual hormone in the body. Um, and what that is supposed to do is supposed to, signal more of the same molecule to be released. Anyways, so the goal of peptides is to more or less replicate the body's already natural signaling process or hormone release process to assist, preferably with your performance, your health, your recovery, weight loss, etc. So now peptides are very controversial because you're not going to see a lot of doctors that are prescribing these in their, in their typical practice. Peptides are they're not new in the market. They've been around a long, long time. However, peptides have entered this gray area where there's some peptides that have been patented by specific drug companies, like the Ozempics and the weight loss drugs. And these ones have come under a lot of fire because they become um, hard to get in some cases. They become expensive in other cases. There's lawsuits involved, because some of these peptides are naturally occurring in the body. In a lot of cases, you can't get a patent for, certain, types of proteins or peptides. So there are some that are well researched and backed up by a lot of research, and others not so much. Others, there's a lot of controversial uses in the body. What I'm going to do is I'm going to talk a little bit about both. In my top 5 favorite peptides, ones that I've experimented with and/or overseen, helped with some of the oversight with some patients. I'll tell you a little bit about where some of these are sourced, why some of these are safer than others, why some of these peptides are not prescribed in a traditional primary care practice, etc. So, well, let's jump right into it here. So, I want to first talk about a particular class of peptides called growth hormone secretagogues or growth hormone optimizers. And what you have to understand about growth hormone is it is released in the body, generally speaking, at night. Okay, so in times of like sleep and fasting. So what happens is your hypothalamus and your pituitary, they're close in proximity in your brain, and your hypothalamus releases something called growth hormone releasing hormone, which stimulates your pituitary to release a chemical called growth hormone or a hormone called growth hormone. And that hormone, it has many effects in the body. As we age, your growth hormone levels will naturally decline over time. Hence why recovery becomes more difficult, bone density decreases, etc. One of the other things that growth hormone does is it stimulates another hormone produced by your liver called IGF-1. So IGF-1, what that stands for is insulin-like growth factor. And this does similar types of properties in the body, again, for fat burning, muscle recovery, muscle building, etc. So, one of my favorite class of peptides, which I've also experimented with, are called growth hormone releasing hormone mimickers. There's a couple different ones I've worked with. One is called sermorelin, and the other one is called tesamorelin. They're both FDA approved. They're approved for conditions like lipodystrophy, to eliminate visceral fat, and they've studied this in HIV patients. Sermorelin, they've studied this, but it's helped improve sleep quality, muscle repair, lean mass retention, etc. And what this does, sermorelin and tesamorelin, it mimics natural growth hormone release by injecting a partial peptide that looks like growth hormone releasing hormone. So what it does is it kind of juices up your body's natural secretion of growth hormone, which again improves your recovery, improves your ability to burn fat, and attain deep sleep, which is very important. And as I mentioned, growth hormone and IGF-1 do decline with age. This is one of my important tests. This is in my top 10 tests. For those individuals over 40, IGF-1 is a really important hormone to measure. You want to make sure that that's as robust as possible, and because that's really critical for recovery and fat burning. And I like these peptides because they don't shut down your natural growth hormone rhythm. In other words, it doesn't shut down your endogenous production. Unlike synthetic growth hormone, which you've heard of, um, taking actual growth hormone will suppress your body's ability to make natural growth hormone. So these peptides, they just juice up your ability to make more of what you're already making. Um, so there are a couple concerns with these. Um, and the concerns that I've seen is they can raise cortisol levels and glucose. So they do require like some definitely some attention, some oversight. They do require that you're watching that the patient is getting good results. They're monitored closely. That's not, make having the opposite effect, screwing up their sleep, getting blood sugar crashes, etc. It does require. It is a pain in the ass. It does require like nightly use. It is an injectable peptide. It is one that's what's called reconstituted with bacteriostatic water. So the peptide comes lyophilized, is what it's called, and so it's like a powder, and you reconstitute, or in other words, mix it with bacteriostatic water, and then what you end up once you do is you inject small amounts subcutaneously, in other words, under your skin. It's very easy. You use little insulin like insulin needles, very small needles, usually around the navel is where you put it. And you do have to do this, at least 5 nights a week. Small amounts, like I said, 1 to 2 milligrams before bed. With the tesamorelin, 2 to 300 mcgs of the sermorelin. And again, the dosing is important as well. So the routine regularity and the dosage is important, which is why I'm a big fan of working with practitioners that are prescribing and giving you the recommendations and giving you oversight. So that's sermorelin and tesamorelin. The difference is sermorelin is a little more gentle. It's a more gentle peptide. Um, the tesamorelin is more powerful. In other words, it is a longer lasting peptide. So you're going to usually see that reflected in the price. Sermorelin is less expensive than the tesamorelin. Let's talk about type 2, which are more or less ghrelin mimickers. So ghrelin is a satiety hormone. In other words, it's a hormone that is made in the body that tells your brain that you're full, or sorry, that you're hungry. My bad. Um, Peptides in this class are things like ipamorelin or MK677. So what they do is they mimic ghrelin, which is the hunger hormone, to increase growth hormone secretion. And this is a different pathway. It's called the ghrelin receptor pathway. So the difference between MK677 and ipamorelin is MK677 is oral. This is one of the only oral peptides out there that is actually pretty effective for this type of growth hormone increase in the body. Ipamorelin's injectable, kind of like the sermorelin, tesamorelin. So what the ipamorelin does is it offers like a clean growth hormone pulse, which with minimal side effects, and again improving sleep, increasing lean body mass, and the MK677, similar types of effects in the body. It can increase growth hormone and IGF-1 by up to 100%. Actually, research has shown. They've researched this in elderly to increase muscle mass, and it's often used as a tool for recovery and anti-aging as well. So the concerns with the MK677 is it can cause hunger, of course, as well as ipamorelin. It can cause hunger, water retention, and again the blood sugar thing, like a little bit of insulin resistance type of symptoms. So again, you want to be careful with the blood sugar, which is why it's not always great to use with overweight, obese, patients who have insulin resistance already. So you want to be careful with that. Ipamorelin is, between that 2 to 300 mcgs at night. MK677, that's the oral, 10 to 20 milligrams daily. Most of these peptides are taken at night before bed, but you can also do these in the morning, again, in a fasted state, to increase that growth hormone and IGF-1 stimulation in the body. So those are, my first two peptides there that are growth hormone and IGF-1 related peptides. Both of them, fairly safe, effective, well researched, but again, controversial. There's no long-term research shown on, human studies. Um, and I should add that peptides are very confusing also because there's not a lot of doctors prescribing these. Um, and because a lot of them are not available at traditional pharmacies, you have to get them from, usual compounding pharmacies, as well as you're going to see a lot of peptide markets pop up on the internet. And these peptides, of course, are not FDA approved, and they don't require a prescription. So you're going to see a lot of labels and warnings on them, such as not for human consumption, animal use only, etc. So it's a little disconcerting. It's very difficult to trust peptides on the market that are not FDA approved and not being prescribed by a doctor. That's why primarily I'm, of course, a fan of safety, efficacy, and making sure you have a prescription. And that leads me into my third class of peptide I want to talk about, which is called BPC 157. So now, of course, BPC 157 is very difficult to get prescribed. For some reason, this one was removed by the FDA as far as one of the peptides that was approved for prescription. So, for whatever reason, whether it's political or financially incentivized, I don't know. But BPC 157, a lot of people have heard of this by now. There's a lot of athletes that are using this, a lot of people using this for wound recovery, tissue repair. It's a very potent peptide that's made naturally in your body. And BPC is actually made by the gastric juices of your stomach. And what they found is you can take these body protection compound peptides and inject them into the body in particular areas that you want focused healing. And it does accelerate tendon, ligament, and of course gut healing. If you're trying to heal your gut, you can take them orally as well. It promotes angiogenesis, which stands for increased blood flow and formation of new blood vessels. Uh, which, if you've been to my office before, we have a tool called SoftWave. And the SoftWave tool is a tissue regenerative technology that uses potent shock waves, which is a supersonic sound wave, which can stimulate the fibroblasts and the tissues in the body, ligaments and cartilage, to signal the brain to send innate stem cells and increase what's called angiogenesis or blood flow, which is really cool. BPC also does this. It migrates fibroblasts, produces collagen, increases blood flow. It's really, really cool. And just to give you full transparency, so I mentioned this one's very difficult to get prescribed. So I have started to work with a compounding pharmacy that has very trustworthy third-party testing. They have safety and efficacy studies. Of course, it's not FDA approved. And I did use some BPC 157 from this particular lab that I'm going to partner with, and I used it on my elbow. July 2024, doing heavy skull crushers. On my left side, I have some neurologic weakness. It's from an old hockey injury, and I do have a slight weakness in what, to me, I think it's the long thoracic nerve. It comes from the C7 vertebrae in my neck. So I do have some lat weakness. I have some weakness in my tricep as well as in my deltoid, which I think is the partial innervation from that nerve. So there, I do have imbalance that I, constantly work with. And I was doing a skull crusher and I felt a pop in my elbow, or French press, whatever you want to call it. And as soon as this happened, my elbow just screamed in pain. I had swelling, and I got a nice big juicy olecranon bursitis. Is what it's called. So I had a big old bursa sac blown up on my elbow, and chronically for months and months and months, this thing was painful. It was swollen. Of course, I didn't take a lot of time off training. I'm a chiropractor. I'm constantly using my elbows. So it wasn't like I was laying off it very well. However, 2 months ago, I got sick and tired of dealing with this thing. I had rehabbed it. I had done soft tissue work, chiropractic work. I had done soft wave on it. I had done supplementation, anti-inflammatory protocols. My lifestyle's clean. Modified my training. I got elbow sleeves, blah, blah, blah. I get a course of BPC 157 from this particular compounding pharmacy, and I started injecting my elbow. And lo and behold, after 30 days, one bottle of it, my elbow is as good as it's been since the injury. So this stuff works. There's a lot of athletes, lifters, anyone recovering from injury. It's like a cheat code for repair and resilience. There's a lot of animal studies done with BPC 157, showing faster tendon, ligament, and muscle healing. Of course, it's all anecdotal human reports here. Uh, so again, it comes with a caveat and a warning. So there's no FDA approval, no large scale human trials yet. It's the research is promising, and clearly there's like hundreds of thousands of case studies that are anecdotal that people get great results with this. You just want to be careful sourcing. Just always be mindful of that. So the dosage I used on my elbow was a subcutaneous dose. It was I think 250, and I ramped it up to about 400 mcgs at the injury site. You can take oral BPC 157, and again, the oral peptides are not as potent or powerful because they have to pass through the digestive system. But if your target is the digestive system with one BPC 157, it's very good for repairing gut tissue. I've heard of patients getting some significant help with things like Crohn's as well as um, IBS types of symptoms. Okay, so let's talk about number four, which are the peptides that you've heard of, the GLP-1 agonists, as well as the GIP agonists. So the first one here is called semaglutide, and you've heard of this one as far as the commercial name for it, Ozempic or Wegovy. It stands for glucagon-like peptide, and it's a glucagon-like peptide agonist. Okay, that's what semaglutide is. What it does, it's very powerful in suppressing appetite, slowing down what's called gastric emptying, as well as improving insulin sensitivity, which of course the goal is to promote weight loss. So you hear about a lot of people using this peptide for weight loss. A lot of people are getting this prescribed um, because it is backed by some significant research. You may have heard of the STEP or SURPASS trials showing like 10 to 20% of body weight loss with these what we call drugs or peptides. They're actually peptides, and also a significant improvement in A1C, which is an important biomarker for everybody, but particularly diabetics that are trying to lower their blood sugar. And curiously, a lot of cardiovascular markers as well and inflammation. So there's some cool stuff happening with these peptides that aren't just weight loss related, also with cardiovascular health and inflammation, etc. So the gastric inhibitory peptide, okay, it's a hormone produced in the intestines, and what it does is it helps regulate blood sugar and appetite regulation. So that's why this GLP-1 agonist, right, or semaglutide helps inhibit some of that, gastric emptying. It curbs a lot of the cravings for the foods. And it does improve your blood sugar. So, we'll talk about some of the problems with these peptides in a moment. I want to introduce the second one, which is tirzepatide. So we talked about semaglutide, right? The Ozempic, Wegovy, the one that's the glucagon like peptide agonist. There's also one that's a combination GLP-1 agonist and what's called a GIP agonist. Um, so the tirzepatide is a gastric inhibitory peptide. I'm sorry, I probably screwed that up. Hold on. Yeah, sorry. So the glucagon like peptide, that's the GLP-1, sorry. Glucagon like 1, okay, agonist, which is semaglutide. Now, the gastric inhibitory peptide is called a GIP or tirzepatide. And tirzepatide is a combination GLP and GIP. Okay. So it's again stands for the GIP is a gastric inhibitory peptide or glucose dependent insulinotropic peptide. So try to say that 3 times fast. Anyway, now that I've created all kinds of confusion, um, what you need to know is these drugs are or peptides or commercial names are Mounjaro and Zepbound. So the glucagon-like peptides are Ozempic, Wegovy. Okay, the glucose-dependent insulinotropic peptides, okay, which are the combination are Mounjaro, Zepbound. So basically, the GIP is one of the two main incretin hormones, right? So there's glucagon-like peptide, glucose or gastric inhibitory peptide. They both improve insulin sensitivity and treat blood glucose. So, and that's what these trials that have been done. They've shown some pretty robust weight loss, up to 20% body weight loss, lowering in blood sugar. And they've shown that the tirzepatide outperforms the semaglutide. So there's a lot of powerful stuff, happening with these peptides when it comes to weight loss, when it comes to blood sugar regulation, when it comes to overall, like even cardiovascular health. So here's the concerns with these peptides, and they're valid concerns. There are no real long-term studies as far as what we've seen out there. People using these for 20 to 30 years, etc. Because the recommendation is you do continue using these. However, just like the other peptides I talked about, these peptides need to be um, compounding your improvements that you're getting already from exercise, okay, weight training, from sleeping properly, from improving your diet and eating well, okay, from drinking water and de-stressing. So those big five levers, right? If you're not doing the work, these are not magic bullets. Okay, one of the gripes with these peptides is that once you stop taking this peptide, most people gain the weight back. All right. And in a lot of cases, it's just the same thing as, any other easy button that people are pushing to try to lose weight, whether it's an injection, whether it's a pill or a potion or a lotion or a, you know, quick fix 7-minute ab. Like none of that stuff is ever going to work if you're not bought into the lifestyle that is going to make it sustainable. So aside from, yes, you do need to continue to take the peptides in order to continue to benefit from the result. You can taper off, but if you haven't established that clear regime of, eating properly, exercising, and sleeping well, you're going to gain the weight back. Not to mention, these peptides have, side effects that are concerning like nausea, constipation, fatigue, um, and then that whole risk of rebounding, which is why it's really important to, combine or paired with lifestyle, which is why you need the medical oversight. Even better, not just medical oversight, but a coach who's going to be helping keep you accountable, help you make those shifts in your lifestyle that are going to become sustainable practices, right? Going to bed on time, waking up, meal prepping, eating well, strength training, and establishing that kind of routine and lifestyle in order to keep the weight off. The semaglutide, tirzepatide, um, dosages change depending on the individual. They're both of them. You typically start small and work your way up. Semaglutide, you start usually with a couple milligrams every week for a month, and then you build from there. Tirzepatide, you're starting with, anywhere from 2.5 actually to higher 10 milligrams weekly. You just titrate these slowly, and you make sure you're monitoring for side effects, making sure you're monitoring weight loss. Preferably, you're working with a coach who's going to watch your body composition as well. Of course, you've heard about people losing muscle mass and bone density with these drugs. Those are generally people who are not pairing lifestyle with these drugs. They're not doing the work. They're just relying on the easy button, which is just the injection, which they're powerful enough to work because it does curb your appetite. It does curb some of your cravings and your blood sugar, etc. But the thing is, if you stop taking it, you bounce back if you haven't paired with lifestyle. Anyways, you get it. So just a couple of concerns with those. There are some patients I am working with that are taking those and getting some profound benefit though. So they are very effective and for the most part fairly safe. Um, based on some of the clinical trials that are coming out now. Okay, fifth and final peptide I want to talk to you about, and this is one I just started experimenting with. I shared a little bit about my journey to get my hair back. And as some of you know, I did go to Colombia this year to get hair restoration. So on the crown of my head, I'm sure you can see it's growing back a little bit. The jury's out. I got to wait, 6-8 months before really assessing how well it worked and how I was able to hold on to the hair. But I've started with some practices, of course, to try to keep the hair I already have, but also keep the transplant hair. And one of the cool peptides that I've started to research and work with is called GHKCU. Um, and this peptide is pretty neat because it can be used in a topical cream or a spray, or you can use it as an injectable. So it's a powerful skin, hair, and tissue regenerator. So it's a copper binding peptide that activates things like wound healing and collagen production and actually hair regrowth. So a little bit like BPC, but this one can actually target more the hair regrowth. It also shows anti-inflammatory DNA repair properties. It's pretty neat. So there's the subcutaneous injectable types of GHKCU, and microneedling. If you've heard of that, which I'm doing a little bit of that, and I actually have a GHKCU spray that I'm using on the top of my head, as well as I have another topical that I'm using with a little bit of what's called minoxidil. But I do use this copper peptide in a spray form, and I microneedle, a couple times a week on my head to get it more into the skin. And being starting to be used in some hair restoration protocols, as well as I do have a skin cream as well with this GHKCU peptide, which is showing some anti-aging properties that include tissue remodeling, recovery, etc. So there's studies that show like improvements in skin elasticity, healing, and again the gene expression tied to repair. It's one of the most powerful cosmeceutical peptides, that's starting to become really popular. You're going to see a lot of companies that are going to start using this GHKCU peptide in a lot of their products. There's very minimal concerns using this. Maybe skin irritation if you're using it topically. There's limited studies, of course, with this one. You're going to have a hard time finding this one not from a non FDA approved lab. Sorry, from an FDA approved lab, you're going to have a hard time finding this or getting a prescription for this. So this is one, if you do want to use injectable, you'll have to source from a reputable, peptide company. Um, However, there are some topicals, again, with this peptide usage that I've seen work pretty well. So there's like topical 2 to 3% GHKCU serums you can use, or sprays like the one I'm using, and injectable. It's between 100 to 200 mcgs daily, and again that's off-label use. So in conclusion, as far as my top 5 peptides, so just to recap, hopefully I didn't create any confusion around this, but there's two types of IGF-1 stimulators, which work with that growth hormone peptide pathway or growth hormone pathway. So there's the growth hormone releasing hormone stimulators, and then there's the ghrelin type of mimickers. So there's the two different divisions, right? The tesamorelin samorelin is the first one I discussed, and the second one was that ibutamorin, aka MK677, and ipamorelin. And then we talked a little bit about my second one there, which is the BPC 157, for wound healing. And then we talked about the tirzepatide, semaglutide, and lastly the GHKCU. So those are just a small sample of some of the peptides. Those are most of the ones that I've experimented with personally, and that I'm overseeing patient cases. There are a lot of other peptides out there. Many other ones you're going to see. And of course, there's a lot of other really good ones that we'll talk about on later episodes. But as far as my top 5, I really love these. And just again, I want to stress that these are not magic pills. Peptides are not magical solutions for problems. What they can do is they can really promote powerful mechanisms in the body when paired with things like strength training, nutrition, sleep, stress reduction. They can unlock serious potential. So, work with a knowledgeable practitioner, get your labs done, and make sure you're prioritizing lifestyle. Those are 3 things I can't stress enough, because that's the main lever for progress and for improvement. And with peptides in specific, work with a reputable practitioner. There, of course, aren't always FDA approved peptides for everything. But if you're working with a knowledgeable practitioner, they can help guide you if you ever wanted to go a different route. But yeah, there's a lot of questions around peptides, a lot of controversy. but a lot of really great research coming out more and more every day when it comes to some of these peptides that we discussed today and others. So I will be talking about peptides more in the future. But as far as my first introduction, those are my top five, you guys. Hope you enjoyed this episode, and definitely tune in weekly. Every Thursday, we'll be launching a new podcast on metabolic movement and mindset. And as always, please feel free to share this podcast with somebody might think benefit. Please rate and review, and I will see you guys next week.